Hello, my name is Neil Ward. I have an order today to administer 4 medications to my patient, Mr. Smith. I'm going to check the medications I have in my cassette or my drawer versus what my order is and compare it with the MAR to make sure that all 3 items match up and that everything is correct. In doing so, I will be observing the 6 medication rights, which is the right time, the right patient, the right dose, the right route, the right medication, and eventually the right documentation. So I'm going to come over to my cassette. I have my MAR open. This is my MAR. And on my MAR, I'm going to check my first med, which is amoxicillin 250 milligrams, to be dispensed at 1900 or 7 o'clock. It is now 18:55, so it's 5 minutes until I can dispense. I'm looking at my first med. It is amoxicillin 250. I'll take my pen on my MAR and I'll make a little dot on my MAR saying that I have confirmed that. I will take this and I have my medication cup, my amoxicillin, and I will dispense it into the cup and throw my trash away. My next medication is metformin, 500 milligrams. And I look at my MAR and I see that I have 500 in my package and I have 500 in my MAR. And it adds up with my order. All 3 are correct. Going to dispense the metformin into my medication cup, throw away the trash, and then I have my diphenhydramine or Benadryl, 25 milligrams. I'm going to open my capsule. Oh, these are tough. Yeah. Okay, maybe you can just pop it. Okay, I popped my Benadryl into my medication cup and dispensed with that. Now I am going to get my 4th and final medication, which is a liquid Tylenol, acetaminophen, and it's liquid. And I have my measuring cup here. I'm going to put this on a level flat container, and I require 15 milliliters at 500 milligrams per 15. So we'll now put my 15 milliliters, excuse me, and I'm going to eyeball it. There's a 15 milliliter graduation on the cup. And eyeballing it on a flat surface, I'm exactly at 15 mils. And now all my medications are prepared. I'm going to do hand hygiene. Put on my gloves, clean gloves, and I'm going to take my medication into my patient's room. I'm going to knock on the door. Hello, Mr. Smith. How are you doing today? My name's Neil. I have your medication for 7 o'clock. Is it okay to take them now? Mr. Smith says yes. I help Mr. Smith into a comfortable position. Typically medium to high Fowlers, so that there's no risk of choking or aspiration. Ask him how he's doing. Mr. Smith says he's doing fine. Great. I have my meds. I prepare for dispense. I have a glass of water here. Ms. Water said, Mr. Smith said he's fine with water for now. I'm going to ask Mr. Smith his date of birth. He tells me it's 12/15/77. That matches with what I have on his MAR and my data I have, so I have 2 identifiers. Those are correct. I'm going to also tell Mr. Smith what he's going to receive today. His 4 medications are amoxicillin 250 milligram. That's for an infection the doctor ordered. It can potentially have mild GI upset, nausea, vomiting, diarrhea. It can cause some dizziness. It's also can cause mild rashes sometimes. I also have, as an adverse effect for amoxicillin, I tell Mr. Smith that in rare cases it can have allergic reactions if he's allergic to any penicillins or anything in that family. In extreme cases, it can cause liver disease or even blood disorders. The next medication will be metformin, 500 milligrams. That's for his high blood sugar levels, to keep his blood sugar levels normal. Again, the side effects are GI upset, abdominal discomfort, and adverse effects may be hypoglycemia, B12 deficiencies, or in rare cases, lactic acidosis. The third medication is diphenhydramine, also known as Benadryl, 25 milligrams. Side effects can be drowsiness, a feeling like a hangover, dry mouth, dry sinuses. It's an anticholinergic. Constipation cases, and in rare cases it can cause heart palpitations, seizures, and not to mix it with alcohol. It's also dangerous if he has glaucoma. And the fourth medication is the liquid Tylenol, 15 milliliters at 500 milligrams. It can cause GI upset. Adverse effects can be liver damage. And I ask Mr. Smith, do you have any allergies that you know of, whether it's food, seasonal medications? His MAR says NKA, and Mr. Smith confirms that he doesn't have any known allergies at this time. After telling him all the possible symptoms, side effects, or adverse effects, I ask him to let me know if he feels any of these or senses any of these after his medications. He agrees. He says, okay, great. And I ask him if he's ready and comfortable and ready to take his medications. And if he has any questions, to ask me anything, anytime. He agrees, and then we go. So I take off my current gloves. I perform hand hygiene. And I put on a fresh set of clean gloves. Mr. Smith is comfortable. He's ready. And we start with his pills. He's agreed to take all three at a time. I have his water ready to go. I have his 3 pills, amoxicillin, metformin, and Benadryl. I ask him to open wide. He takes them. He takes a sip of water, swallows. Takes another sip of water, swallows. Takes another sip of water, swallows. He verbalizes to me that all the pills are down. He feels fine, and everything has gone down like as it should. I say, great. And then I tell him, now I have his liquid Tylenol. Here's his Tylenol. I administer. He drinks his Tylenol. Puts it down. Gets another sip of water. I let him keep the water at his side in case he'd like more sips. I ask him if he has any questions, if he's comfortable. He says, yes, I am. I'm perfectly fine. I return him to his original position, satisfied that all his medication has been consumed properly. I give him the call light. I ask him if he has any questions. He says none for now. I remind him again if he feels any symptoms or anything unusual after taking these medications to not hesitate to put his call light and let me know, and we'll attend to him. He says great and thank you, and I hand him his call light. I put his rails up, and I thank him for his time. I remove my gloves out of the room. I take all my equipment with me, all the medication cups and everything. I perform hand hygiene, and then I come back to my MAR, and I've documented now my initial, I've signed the back of the MAR, and that I administered these medications at this time. And that's the end of my pass. Thank you very much.